So today we have been doing this podcast together, which I announced it earlier today. And you guys, oops, my cell phone. You guys do not want to miss this because Ryan is hoping that he's going to join me in a minute. He's going to co-host this live with me. We had a great podcast recording. We introduced a lot of concept of why ear canals and vestibular system is the most integral part of integration of your nervous system, how it impacts your posture, and more importantly, what does it have to do with breathing and sleep? Because what we actually did talk a lot about is the interconnectedness of the human bodies. Let me just acknowledge you guys as you're walking in, and thank you so much for joining me. Flipping Rock, I'm actually going to invite you to be a moderator. If you want to join me, just add in, actually. I think it would be great to have you as well in there in the live because I want more interaction. You guys, this was fun last week, and I love the follow-up questions that I got, and I love the interactions we're having because there's so many people. Hi, everyone. And I just want to make sure I acknowledge everyone that drops in. So fact is, Ryan is, and if you guys want to find his handle, is Ryan, let's see if he's joining me. There you are, Stephen. Ryan is a chiropractor with a specialty in vestibular system. His handle, I believe, is neuro something. Let me just find it and make sure I give you guys the proper. It's the neurobalance solution. There you go. Yes, neurobalance solution. I just invited him to join in because I was completely blown away with what he does on his Instagram. And on his Instagram, and we connected, and I invited him to come down and visit me in Colorado. So the last couple of days, we basically got people upright and sideways and just looking at them, how they're standing, how they're functioning. And what's really interesting, what came up from that was we noticed we've been looking at the same problem, same thing, but from different angles. So the way you're standing up, and they always talk about how you're standing on 2 feet is determining how you breathe, how you function, how you walk through space. But guys, propelling through space is probably the most important thing you do is just you walk and breathe at the same time. Respiration is something we do before when we have gravity to help us breathe, but breathing and respirations are synced up together. And the most important sensory information to help us do it is our vestibular system, is our ear canals. So somebody asked you a question here. Last week you said there was 3 phases of what you do. Yes, Les, I will definitely talk about that today. Thank you so much for reminding me. And Ryan and I had a great conversation. And good news for those of you guys who are going to come see us in Colorado. He is agreeing to come and work with me, which I'm overjoyed because the more chiropractors I work with, the more neurology people I work with, the more easy it gets for me to do what I do. So the phases of treatment. Let me tell you, just go back to the basic. I love to make things complex. I love to appreciate complexity, but I like to make it simple. What really happens is the phase 1 of my treatment is basically separating the 2 ends of the system. Feet on the ground, teeth together. Anyone want to argue with Matt? Argue with me. They have to show me where in the body we're separated, our system separates, other than our mouth and our feet from the ground. When we close our chain of gravity with the ground, our mouth is the only other end that separates. Then we have to stand up and organize ourselves in that mode. So when I decode the patient, I'm the first to start and last to finish. Let me explain. When I separate the 2 ends of the system, you bring my handy dandy skull. Hopefully this doesn't completely fall apart. So when I separate the first phase is to disengage the teeth. Let me explain. When you put your mouths together, your cerebellum becomes a huge part of organizing your sensory information to execute proper motor function in terms of gait cycles. Some of the information that goes into the cerebellum, let me tell you, your feet, every joint proprioceptions, air in your lungs, air in your system, and ears, how the eyes and ears are coordinated together. All of that information has to feed into the system. So basically, first phase of treatment is take the teeth information out of it because teeth overrule almost all the other information because it has to match. It goes straight to the brain, and where your teeth meet when you bite together, that basically determines the course of almost everything else. So first phase 1 is separating them and supporting the mouth where it actually makes sense to support the mouth. basically taking the teeth information out of it and giving the body a proper reference of where the mandible wants to work with the rest of the body for gait cycles. It has to match all the other information. So that's where some other techniques and chiropractic techniques come in, neurology comes in, because when you put your mouth together, your entire system is now distorted. It gives that distortion information, and it has to lock you between those two data points. And the spine is the number one area that absorbs it. So the phase two, what are the goals of phase one? Well, a lot of things has to happen in phase one of treatment. What symptoms patients bring with them becomes a major driver of what happens in phase one. If your body has been living with cortisol in high sympathetic overdrive, that's the first thing we address. If you can't sleep, that comes into many different forms. How's the breathing? How's the walking? How's the neurology? And what areas of your body has been impacted by the inability to properly orient yourself in 3 dimensions? Or what are the reticular system, like the mental emotional aspects that basically has impacted you? So I'm just take a minute. I'm not a multifunctional person, you guys. I'm a bit dyslexic as well. If I talk, I can't read. So let me just see if there's any other questions so I can answer them simultaneously. So oops, there you go. There's Dr. Ryan. You've been hanging out over there. So there you are.
What's up?
Stephen McKay, if you're not going to contribute, I'm going to go ahead and take you off because I accepted Dr. Ryan's because I need my space here. So I know it's England for him. He's one of the patients I treated. Ryan, thank you so much for joining. I am super excited. Let's carry on. We did a podcast, you guys. We did another hour of talking and then another hour of talking after that. I'm like, we will never stop talking.
Yeah.
So let me tell you, Ryan, why don't you just, I have a lot of questions here, people asking. And my heart goes out to people. Yes, dentists, they need to be here. And I am just dying to get to my dental friends to work and understand how the rest of the body works. And just sending a lot of loves here, guys. Tell me where you're logging in from. I'm really interested to know where you're logging in from. So Dr. Ryan, take the baton. Just tell us a little bit about you here, because a lot of people, wait a minute. Did I lose you again? Here we go. I can see your face. Don't know that I did something too. There we go.
Weird. Yeah.
Yes.
Excuse me. Hey, Bay Area, I love it. That's where I grew up. Sorry, what did you want? What did you ask? Sorry about that.
No, I want everyone to just give them a little quick rundown of who you are and how the temporal, my audience know the passion I have about the cranium. But we're talking about temporal bone's importance and sphenoid orientation about the mouth, and the whole mouth is really just coordinated. Call it rocking the feather. Just tell them a little bit about all the things that you're just really good.
What I do, yeah. So I am a chiropractor. However, with chiropractic, just like with med school and other things like that, you can basically specialize in whatever you want to afterwards. You could do pediatrics, you could do radiology, you could do all these different things, sports. And I fell in love with neurology. And so that's basically what I do. Is I do what's called functional neurology. So I rehab the brain through specific exercises. So the thing is, you have to be so specific when you're treating the brain. And if you're just chasing all these little symptoms like anxiety, depression, panic attacks, dizziness, all these kind of things, they're literally just symptoms of dysfunction. So what I do is I figure out what's actually causing this dysfunction, working upstream, and then we can apply an exercise for that. And I work a lot with the vestibular system, because the vestibular system never shuts off. It's part of our balance system. And it is the most constant system that we have, and it's even activated when we're sleeping. So when it's dysfunctional, we can get all these different symptoms like anxiety and depression and everything like that. And it's putting you basically in a sympathetic state, so a kind of fight or flight state. And you can't heal when you're in a fight or flight state. You're too stressed out. Your brain is not receptive to the healing, and maybe even to like the supplements or all these other things that you might be trying to do. You can't just outwork it. So your foot is essentially stuck on the gas, and you're trying to push the brake as well. It's just, we got to get that foot off the gas. And we have to figure out why your foot is on the gas. And that's the biggest thing. We have to figure out what your issues are
Yeah.
rather than just a
No, it's
blanket
so
approach.
amazing. I mean, I talked to more chiropractors these days, honestly, that I do dentist. And I went from the one chiropractor we're trying to onboard, like there's three of you guys now. And I finished up with Dr. Shar, and she's also an amazing, amazing practitioner. We've worked several patients together. And it was all full of just reiterating the same thing you just said. We all agree on this one thing. And guys, not every practitioner sees things from the level we do, because there's this bias that we come out of our school trainings. I did that for 10 years. Ryan, you're blessed that you didn't have to go through all of that. You knew that while you were in training. You shared that
Mhm.
with me. We don't learn to actually look at the body as a whole. That's just the truth of it. We don't learn that. And when we come out of the school, then we start to question. And if you ask the one question of, okay, wait, where did the problem come from? And I love how you said, why, where, why? And then we get deeper. And then at some point, the problems and the questions we ask is no longer fitting within the parameters of our training as a dentist. Nobody ever told me that gut microbiome and the mouth microbiome in training was related. I learned that way afterwards. We learn, okay, there's this 2 points of the body are connected, they're way outside of the dentist. Guys, there's not a single thing that I see in the mouth that is not a manifestation of something else in the body. That's really how it works. That's what the podcast is. If your mouth could talk, I can decode backwards and say everything basically boils down in the mouth. And what Ryan does, and it was just so fascinating. I'm actually going to do some stories tomorrow, maybe another live while we're in the clinic together. Is his equipment is. I'm setting my camera here, and it's falling down on me. We're having his equipment set up, so I'm going to bring some of that to show everyone. Check out that. What is the movement of the eyes and ear have to do with your breathing? That alone is baffling to me. That we didn't know that lack of coordination between our eyes, ears, cerebellum can in fact contort your body and change your breathing rate and depth. And as a breathing specialist, dentist, specialist in airway, the more I learn, the less I put trust in dental appliances. And somebody asked the question, which I'm giving a long-winded answer to, what do I do to treat the condition? Not a simple answer. It depends on what he just said, Ryan just said. What do you come with? What does your package look like? Because if a patient comes in with a basket symptoms, like a ton of information to give us, and it boils down to an orthopedic malalignment that has bled into physiological alterations in the way they're processing food and hormones, HPA, access cortisol, because that happens. And then they can't sleep because of that. Now they have that level as well. The driver was the orthopedics, but now it's all three of them. A good clinician would not be biased into, oop, you got a time tie and a high arch palate. And that's my world. You have a small airway and that might be the end of the problem. That's just one of the tip of the iceberg symptoms, you guys. Everything we called root cause. That's what we concluded today. I'm not giving away the podcast, but everything we talked about today is everything you think is a root cause, it's another symptom.
Yep.
It's just another symptom.
Yep.
Like, isn't that
Like,
true?
it's your Atlas, or it's your C2. Why? Why is it always this? Like, yeah, you're gonna have to listen to the podcast because
Yeah, I
we go
know.
into a lot of detail
Amazing.
with it.
Yeah, and I like I said, I want you guys to ask. This is a wealth of information sitting in front of you guys. If you have any, you want to know what he does, and actually he did some exercises. If you want to check out his Instagram handle, he's got a great following. He doesn't need my shout out, but he's a rock star on his own. By the way, he just appeared on Mike and Kelly's show. I mean, I didn't know
Kelly
the
and Mark.
presence
So
of a
yeah.
celebrity today. So, it's amazing because the world needs to hear what we just said, and we can get all fancy about this and tell you all about the cranium and a CT scan, and at some point I'm going to bring that all to you as well, because behind the scenes we do all kinds of cool nerdy stuff to decode people. But really the bottom line of that is all we are decoding the one thing that rules the whole system, that one thing that makes you human. Yes, breathing, but that even is controlled by your nervous system. That's it. Respect. Your nervous system decides, I want to log in here and listen to this information because it might benefit me. And your nervous system decides it's irrelevant to me. I want to get out of this call. I'm not trying to pressure everyone to stay on live with me, but invite your friends because they might need to hear it. Everything that we see is going on, and your nervous system gets information and keeps it, doesn't lose it, keeps all the information it gets from whether it's being the emotional trauma, we call it concussions, right? Concussions does not come in the form of just getting your head pounded by something. Emotional concussion, chemical concussion, mold toxicity is a chemical concussion. It can just have an impact on your nervous system wiring, just the same as somebody you've had a blunt trauma or a whiplash. So we were talking about how the nervous system gets rattled and dysregulated, which makes the decisions to keep you in survival, because when nervous system is in survival mode, it cannot function properly. Your breathing becomes impacted, your sleep transition becomes impacted, the way you carry yourself through life becomes impacted, and your entire health, basically. Your health is dependent on how your nervous system functions, has access to all branches, and how it can perceive reality and perception of reality and health, right? I mean, health is impacted that. Somebody asked the question of what type of providers are part of your team in the new clinic. Great question. So we're starting with one dentist, well, actually two that I'm training, but one dentist is part of it. And the dentist, forget about teeth. Okay, we're not talking about those white pearly. We're talking about the cranium orthopedic dentist. And then I'm starting with three chiropractors, one that's Dr. Ryan sitting over here, and his expertise is all around the balance and the vestibular system. Honestly, the things that he knows, I have not heard from the ENTs. I mean, respect. This gentleman is, and what I really like about him is he actually, through his training, he questioned what was he learning. That is amazing, because a lot of us come out of school, we get sucked into the mainstream, and then we start asking a question. It's too late. By the time we practice 10 years, it's harder to break through those biases. He doesn't have any of that. He's just starting from the ground of, I'm not going to treat anyone as if it looks like anybody else I've seen before. Every patient we're going to treat like you're the only person coming in. So that's him. That's one chiropractor. I do work with the structural corrections. Mostly I like chiropractors that do understand the mapping of the dura. Dura is the fascia that holds you together, and the dura is what's kind of basically surrounding your nervous system, your brain and spinal cord, facilitates the movement of the fluid that basically provides nutrition to the brain and removes toxicity from the brain. And also working with a nurse practitioner, which kind of checks on all the systems, hormones and guts and HPA, cortisol, microbiome, name it. Because once and only once we are able to look at people from that angle, then we can determine what caused your nervous system dysregulation. 28-month-old with a high palate, swollen adenoids, tilted atlas. Oh my, if there's a birth trauma, I'd like to know about that. Open mouth posture and balance issues. First of all, if it's a 28-month-old baby, I can speak from this. A lot of the babies are born through either they had the fetal attitude, or some position in the womb may have caused some of the distortions that they've had, which basically positions the atlas and occiput, the whole skull and the neck. Because at 28-month-old, the kid should be walking. And I would question the birth trauma for sure. But I would say the best route for that child to start, because they're at 28-month-old, they should have had their reflexes integrated and should be ready for walking, turning their heads and all of that. Genetic condition, low tone. I would work with a craniosacral therapist, people that are good with manipulation, make sure there's no torticollis, no distortions in the occiput position, because all those sutures are still moving and getting some rhythm back into the system. High arch palate is usually a derivative of that, because that child, because the tongue needs to position itself at the roof. I'm just going to attach this because I need my both hands. So the roof of the mouth last time I was talking about, and this is great for you, Ryan, as well, to see. The mid-palatine suture is basically the representation of this, a smaller box that's fitting within the bigger box. The bigger box, if there's any distortion, it basically, through dura meningeal, as I was explaining earlier, is going to control that. So the tongue is also fascial control. The base of the tongue, the fascia of the tongue is connected to all your organs. It's all the way to your toes. Tongue is in fact the control and driver control that it shuts off and closes off the entire system together at the palate. So if you have a high arch palate, if your child has a high arch palate, it's not just lack of breastfeeding. They couldn't breastfeed because there's distortions, the cranium and the fascia. Do we just need to cut it, release it, expand it? No. They have to be diagnosed properly, and they need to be manipulated and properly organize the body with every breath, with every swallow. I'm personally not against, I'm not against or for surgical or non-surgical. It's just what I do. And a lot of patients that come to me, they're wanting to do things outside of, sorry, I'm just seeing another question. So for your child, I love, and I want to reference some practitioners that I personally follow and I love. Dr. Martin Rosen, I'm going to give him a shout out, great practitioner at the Peak Potential Institute if you want to look him up. as a lot of great practitioners that are SOT trained, chiropractors, I do love those techniques. It's just what's working with my hands and my patients. And also, I'm not for or against tongue release. I just think there's a time and a place for it. And I'm for non-traumatic procedures. If you can utilize light lasers to change the fascial structure, rewiring the nervous system, it by far goes a longer way than just doing a traditional tongue release. The birth trauma, you answered that question. Reflexes not integrated, been working on it. Yes, the reflexes are huge. And another institution, I'm a huge fan of Dr. Maskatova's reflex integration, MNRI. If you guys want to look it up, MNRI, they have a nonprofit and a for-profit segment, and I love their practitioners. Work with so many of them, and with children that are not crawling, they're not feeding properly. Occupational therapists that do understand this, they would check reflexes. Reflexes are basically the brainstem, which Ryan was talking about. Reflexes will get us to midbrain, and the midbrain to the cortex. We are not functioning with brainwaves. We don't have brainwaves. We're in twilight zone when we're toddlers, because higher cortex is what produces brainwaves. And when we're growing, go from brainstem, our brains start to form at the higher level, bottom up, back to front. If the brainstem has not been stimulated enough to integrate those reflexes, instead of putting them in a backdrop, we're not dropping them, we're basically integrating them into more motor functions. If that hasn't happened, and Ryan is an expert in cerebellum, that tells me if your cerebellum is not organizing you properly, something is missing. You're not getting the sensory properly integrating, because higher cortex is all about motor functions. When you see this, like dancers doing all the sophisticated moves or twirling around, the athletic people, those are motor functions. They're very sophisticated motor functions. If your brainstem is still in charge, you get where I'm going with this, right? We're expecting our bodies to do things that are not geared to do, basically. 11-year-old mouth breather at night, teeth are not straight. Yep, that's a classic. Crowded teeth is a byproduct of a mouth that did not grow, because the growth doesn't happen just in the mouth in this direction. This is the facial growth direction, and the brain grows in this direction. Cortex, vault, the box, and this. And if you think about it, this is way bigger than this. What's in between them is our airway, is our tongue, is our basically all the neurology and vestibular system, which we spend the whole day talking about. And how we organize ourselves for function will develop those features. So our face grows as we chew, we swallow, we breathe, we speak. Don't underestimate speaking. And one of the things I'm so huge about, our kids are spending way too much time in front of the screens, texting. They're not really utilizing their God-given potential to speak, because our palate, if you think about it, our pharynx still drops below the palate when we stand up so we can speak. That also happens by the time we're 2 years old. Walking, speaking, all those functions that are super important for development of our face basically are getting less and less in modern life. They don't chew, they don't know how to swallow, they're not breathing properly, their tongue doesn't know what to do. Their tongue really doesn't know what to do, because articulation, speech is a huge part. I work with a lot of occupational therapists. I work with children. And Ryan, if you want to take this, because I'm trying to see questions and read through them. I'm not ignoring any of you guys, but I'm not a multitasker. I need a moderator here. Craniosacral therapy, both under SOT. No, craniosacral therapy, they are more like light touch. A lot of osteopaths do manipulations in the palate. They move dura, but there's a huge difference between SOT and craniosacral therapy. The craniosacral therapy is all in the premise of CRI, which is cranial rhythm, and they do light touch with basically reorganizing the rhythm of the craniosacrum, versus the SOT, they actually remove lesions, which I'm a huge fan of. It's like putting butter outside to melt versus putting it in the microwave. It's much more effective, more directed, all that jazz. How did you get convinced to look further than the teeth? Oh, that's a great question. Do we have all the time? Because guys, I'm only doing this. If you're interested to learn about that, I made a video not too long ago, and I think I haven't posted it, but I'm going to give you a little 2-minute. I was a practicing dentist for 10 years. And I fixed a lot of things from last generation dentists. Back in 2019, right at the cusp of 10 years of practicing dentistry, when I bought my practice in Boulder, I started looking at people, the younger patients that I was seeing, and I saw things that they never taught me in dental school. They grind, they have TMJ problem, they can't sleep, they have like similar things, ADHD, and observational trial, you would call it. Like a clinician that looks and said, wait a minute, This is an epidemic. Like, I see this all the time. Why are the same question marks are answered? So I decided that I want to specialize in TMJ because that's what I was seeing most of. They clench, but I don't want to give them a night guard. I didn't think it was doing anything. So that black hole sucked me in. But my personal training background, because I'm a personal trainer, I've done a lot of trainings with physical therapy and chiropractors over the last decade, learning all about what they do for continuing education purpose. And then marrying the two professions, it taught me that the head to tail is connected. So 5 years ago, I decided that dentistry and then mainstream dentistry is really not doing me good. So I'm just going to walk away from it. Literally walked away from it. Just a drill and stopped cutting teeth in the pursuit of finding out how the body works. And in my humble opinion, everything is, I thought it was about the airway, but airway is the byproduct of the nervous system. Your body will organize itself in whichever way possible to get oxygen in, to charge you, to get your brain what it needs so you can stay alive. And if that doesn't happen, you're dead. So everything else that I call you airways, a symptom, and sleep, all of that boils down to the nervous system. And the biggest component of that was the teeth. The teeth are a huge driver of the nervous system because they are the organs that orient your head through the three dimension. And Ryan actually did a great job today telling me about how the head shift actually impacts the mouth. And I'm like, and I thought I knew it all. I knew there's something I'm missing. Couple of light bulbs went on in my head. Again, I'm trying my bestest not to give away the podcast because there's a lot of pearls that we put in. But yeah, do you have any 2 cents to put in, Ryan? If anything comes to your mind that they might want to learn about?
Gosh. I don't know. I mean, I could obviously talk forever about the vestibular system. I just think that it's super important, but it's also the like you mentioned with the cerebellum. It's also the cerebellum helps modulate everything. So it's located just on the back uh,
Mm-hmm.
of the skull right there, and essentially every single thing goes through the cerebellum, almost every single thing, and it kind of fine tunes things. So, like for example, if you're shooting a basket and you miss. Okay, you know that you missed based off of the visual feedback. But it also had a motor plan that was from the cortex that went
Mm-hmm.
through the cerebellum. And to know that you need, okay, that was a little short. I need to push it a little bit further. That's your cerebellum creating that new little like, okay, let's fine tune this, and then it sends it to the motor cortex for it to like actually complete that loop. So the cerebellum helps with everything, and especially with the vestibular system, part of our balance system, it helps modulate all these things. So sometimes it's not just a dysfunctional vestibular system. Sometimes it's the cerebellar control over that vestibular system. And so, like we were saying before, with you got to keep asking why until you can't ask why anymore to get to like that root cause. My why might be different than your why, you know. So that's why you can't be like, oh, I have anxiety too. What's a good exercise for that? I don't know. That's a symptom. I don't chase symptoms. I got to figure out why you actually have anxiety, what pathways are broken, you know, things like that. So it's, I wish it was more simple because I get people messaging me all the time like, oh, hey, I got a concussion a year ago and I'm still suffering. What's a good exercise?
Mm-hmm.
We have so many different pathways. The vestibular system alone, we have about 13 different areas that are involved with just the vestibular system, so our balance system.
Mm-hmm.
So it just depends. And that's why we'd have to do like an exam, figure out exactly what your brain needs, and then give you specific exercises for that. Because, like, for example, part of the vestibular system, we might need to do like a rotation where you stare at your thumb, and we might need to add in like a right arm cerebellum figure eight type thing in addition. So we might need to like rotate like this, or we might need to go the opposite way, or we might not need to do the cerebellum with it because that might be too much for the brain to handle. So we have to figure out what combination your brain actually needs to
Mm-hmm.
figure out how to actually help you.
Actually, I had a question here, Ryan.
Sure.
Saleh asking that he had a chemical exposure on the scalp. He said it caused me to develop a stutter. 1 year later, I still have sensitivity to sound, especially behind me. Oh, behind me. Okay, so that's part of the vestibular system you were describing to me today. Anyone walking and talking behind me makes me feel dizzy. Do you have any inputs for Saleh?
Feel dizzy? Is that the symptom? Is
Yeah,
dizzy?
and it says
Or,
and it says the head shape changing over time. If that's what you experience, I can explain that one. Why did this change? What did they tell you, especially on the back of the head? So then let me tell you, what the back of the head, the shape of the skull is not fixed. contrary to what people think, the skull bones are not fixed in time. The sutures come to becoming not closed, solidifying to hold your brain, but they can be moved. We can manipulate them. They're literally inside the sutures. There are tissues called reciprocal tension membrane meningitis. If you get meningitis, that's this fluid between your skull and the brain that holds your brain and basically cushions your brain. So those meninges are wired through your skull to your mouth. So basically, as your mouth changes and the fluids inside the head, gravitational force, the shape of the skull changes. Absolutely. I see this all the time. I have seen it change within weeks of some treatments. I mean, all the cases I'm going to start posting for you guys, shape of the skull changes, the shape of the face changes, and vestibular system is responsible for making sure you stand up and you can organize yourself in 3 dimension. That's it, pretty much.
Yep. Yeah, knowing where you are in space is almost the name of the game. Like, if you don't know where you're at in space, it literally sends signals from your vestibular nuclei in the brainstem to the amygdala, which is your fight or flight area, that there's some kind of danger, some kind of threat, something's wrong. And so, like, the vestibular system literally helps you. I mean, it could be the main culprit for POTS. It could be, I mean, if you think about it, you're scanning POTS. That is a vestibular type movement. And so when that's dysfunctional, that could be the symptom is, you know, POTS. It could be a bunch of other things too, but there's a huge vestibular component to that. But yeah, the name of the game is, do you know where you're at in space? And one of the tests that I do, which is awesome, is I use something called a VNG, which is video nystagmography. And basically what it is it's kind of like those virtual reality goggles that you put on. And the first test that I have is it's 15 seconds of darkness. You're supposed to just look straight ahead. And in darkness, when you have nothing to actually look at, straight ahead might mean something different for you. And you might have a drift in a certain direction. You might go cross-eyed. You might have what's called square wave jerks, where your eyes are just bouncing around. This all tells me that you have no idea where you're at in space, and the direction of these things can actually tell me what's going on as well. So that test alone, I can pinpoint basically where you think you are in space versus where you actually are in space.
You know, somebody asked the question, Ethan Johnson says, do you use a bucket test for subjective visual vertical or just read about it? Actually, tell me more about that, because you talked a little bit about this today as well.
About the bucket test, or?
Yeah, the vertical test that you do, is that what it is? Because I'm not familiar with it.
No, the bucket test, as far as like I was taught, it's basically you kind of put on this bucket and then you, I want to say it's testing optokinetics. Is that what you're?
Yeah, I'm just trying to help me understand. Is this the question? If you want to just put something in the comment, I would like to make everyone.
Yeah, so I'm pretty sure subjective visual vertical. Yeah, so basically, I have a test called optokinetics. Optokinetics are the way that we do it is it's in the VNG. So there's red and black lines that move from right to left for 10 seconds and then left to right for 10 seconds. And then a new test is top to bottom for 10 seconds and then up to bottom to top. So what that is when those lines are moving like this, it's visual perception of rotation. So for the first 10 seconds, when the lines move right to left, you feel like you're rotating to the right. Because when you rotate to the right and you're looking out, the world moves to the left. So it's a way for us to see how are you perceiving visual motion. And that's one of the tests, which I was going to tell you earlier. That's one of the tests that I can see for like social anxiety, for example. So real quick, we have something called a vestibular ocular reflex. So when I look at you and I move my head to the right, my eyes in my socket to maintain that visual fixation move to the left. Okay, that's a reflex. So vestibular ocular reflex, okay? So if I move my head back like this, but I'm still looking at you, my eyes move down, okay? So that's my head basically falling backwards, my eyes go down. So during the optokinetics, when they're going left and right, what should happen is a nystagmus, so a rhythmic beating of your eyes as the lines are moving. Okay, that's a normal response. That's what we should be seeing. It's a reflex. But if I also see a downdrift with that, I can tell that you have something that's pulling you backwards as well. So because your eyes are drifting down. So you're getting this kind of like perception of falling backwards. We don't want to fall backwards. We don't have eyes in the back of our head. Our arms can barely go back there. We do not want to fall backwards. It's a tactile response or like a startle response. So we feel like we're falling backwards when our eyes are drifting down like that. And so when people get a down drift during that test, I can tell that they might have social anxiety. And this is that same kind of thing. So it's the visual perception of movement. So I get a lot of people that tell me they're just like, oh yeah, whenever like I'm driving, I can't handle it, or grocery stores, or watching TV even. They're like, oh, I get so like kind of disoriented, and it's because that visual vestibular system is dysfunctional, and it could actually even be the peripheral vestibular system that is just so overactive that it's getting stimulated even when we're just looking.
And I see this a lot, Ryan, with concussion patients. When I track down their CBCT, I see a lot of lesions that's connected to the side of the skull where I can see the sutures are jammed. So basically, and also another thing is when the temporal bones, which house this whole information, is getting locked in, the cranium is not properly moving. So there's several things that's happening. I'm just going to name a few of them. The flow of the spinal fluid is going to be limited in that part of the skull. That's one of the direct impacts of the concussion. And the other impact of it is when the dura-meningeal system is impacted like that, basically the wiring. So think about the dura-meningeal as like the wiring, the hard wiring of electricity channels. So part of the brain is like not getting the stimulation properly. And underneath that is temporal bone, temporal lobe, and the temporal lobe is the house for our amygdala, hippocampus. Now we talked about concussions, and I just referenced a few things that can be referenced as concussion. It's not just physical concussion, but chemical concussion, mental, emotional concussion. We're not even talking about that. And you know, when we see people that have you actually, again, I'm not trying to give away the podcast, but when Ryan talked about his own experience, what he had was several layers of compensations physically, but when an emotional concussion came in, the bucket overflew.
Yep.
And it was just amazing that the things we presented. You guys look out for this episode. You're going to gobble it up. Sully's asking another question. I want to make sure I'm staying on top of this. As far as what prospective patient asking if coming down here you need to work necessarily with SOT, going back home. To answer your question, continued care when you're in appliance therapy, the goal is to reorganize the body and the cranium, which means you're going to continuously see in a chiropractor or someone can help you with that structural balancing. What Dr. Ryan does is first when he determines what your cerebellum needs for to be retrained, those are exercises you can do at home. He's not an adjusting chiropractor, nor is he someone that has to see you all the time. It's what to do, how to reorient your own brain to know left and right. So many of the exercises we do, whether it's tongue, whether it's breathing exercises, whether it's gait cycle, and cerebellum, it's going to be something you do at home. But at some point, as you're tuning and maneuvering the structures here, you're going to need to have people that can help you with the structure outside the mouth. To answer your question, yes, SOT would be great to have, but within the first 2 to 4 weeks, most patients I see, we get down to the bottom of it and see what we can do remotely. I have patients like right now, Stephen is right here on the call with me, minus his dog eating the appliance one time and I have to ship another one to him. He's on cruise control. Like he literally is on cruise control. So I treat patients all over the world and it's not easy, but it's possible. And they only need to come see me for every 3 months to make sure they're on the right track. So yes, the reason why we're establishing the center is because I want to make this top level Michelin star level Mayo Clinic on the go available to everyone. Having access to health, it's a given right. Disease management is the system. And we talked all about that. And I was just so overjoyed to hear someone right out of school and gets it. We are in a perpetual cycle of managing disease, because doctors know how to prescribe drugs. Thank you for saying that today. They're not medications. Medication has a connotation of health. And I'm not denying that sometimes you need that if you're that far gone. But we don't spend enough time understanding what the patient needs to heal themselves. Even if they need some medications, we just go straight to the drugs because it kills the symptoms. But symptoms tell us where to look. What are we killing them? I'm guilty as charged. I used to do Botox for all this TMJ problems. I'm like, wait. I don't know where the pain is coming from. Putting a splint in their mouth they have to chew with, that tells me I don't know where their teeth are supposed to be. And when I found out the bones that carry the teeth are way more important than the teeth, that perspective changed. And by the way, my amazing assistant, Liliana, reminded me to tell you the rest of my story. And I want to get to the last 2 questions. She reminded me to tell you guys, my eyes opened up during pandemic. And coincidentally, at the same time, my 5-year-old daughter at the time was battling sleep apnea, which one of you guys addressed, the large tonsils, the snoring, ADHD type. And at 5 board certified specialists that I saw, They couldn't give me the answers. So me becoming the best version of me as a dentist, coinciding with the daughter, like my child was literally dissolving in front of me, grounded her teeth down to the knob, and she had large tonsils, which with the recommendations of that's the only standard of care for sleep apnea for children at the time, removed the tonsils, as I like to call it, amputated them. And did it solve the problem? No. And the adenoids returned because the problem was chemical, it was more than just one thing. It was immune system dysfunction. It was inflammation cycle that was turned on, dysfunctional breathing. It was structural. It was imbalance in the system. And all of that and then some. And she was an emotional basket case. And we're just looking at it. And all of those providers, 5 board certified specialists told me, go home, come back when she's 8. By the time the child is 8, guys, the face is done, like the projection of the face is almost done. The face of an 8-year-old is just as far forward as it comes. Like if you haven't caught it by then, we're basically setting them up for a lifetime of braces and dysfunction. Let's get them growing. Get them growing. I honestly, I'm anti anything that is opposing what body was supposed to do. Get them the right nutrition. Give them the right love and emotional support. Get their bodies functioning and moving and growing. You can have a whole another set of next generation. This is why permanent retainers, yes, that's what we do all the time. And I remove them with cautions because I've seen a couple of cases go south, but we have chiropractors on site, so I'm not worried about that. It comes with an eye mask that he's talking about. There is a sound healing app.
Yeah, I wanted to talk about that. So
yeah, hear that one.
sound can be amazing, especially like, the binaural beats and things like that. However, and usually the mechanism is trying to stimulate certain brain waves. And the thing is, like we mentioned in the podcast, I think we did, we got to ask, why are these brain waves dysfunctional in the first place? So something like that, I don't know this product, but it sounds like it's just a good little Band-Aid that you might want to do like before bed or something like that. It's not going to give you permanent, solutions or anything like that, because it's something that's going to be just kind of temporary, short-lived. Because if it is that, if that's the mechanism of, kind of stimulating certain brain waves, the brain waves are responding to, these broken neural pathways essentially. So when we can fix those broken neural pathways, that's when the brain waves start behaving the way that they're supposed to, rather than just, okay, we still have this broken road, but now I'm going to try to, put on the sound and try to fix it. So that's my thought with it. But that kind of stuff, don't get me wrong, I love those kind of things. I use something called a neuro wrap, which is a PEMF and a red light little wrap type thing that can actually stimulate the brain. I love that. I use a resi.
Right? The
What's that?
laser that stimulates the mitochondria.
Yep, the lasers, the Resimax, which is like a vibration
Oh, I
device.
love
You could do on your trigeminal nerve, you can do it on your vagus nerve, all these kind of things. However, they should be used in conjunction with trying to figure out what pathways we actually need to rehab. So those on their own, same with chiropractic. Chiropractic on its own is an incomplete modality. Massage on its own, incomplete modality. Like, we need to address the root cause, but we definitely need to do these things in conjunction with that. So like, if you're not sleeping, you're not going to heal if you're not sleeping. So if those like beats or whatever it is, that device can
I know one company called Brain Tap.
yeah.
Brain
Yep.
Tap. Yeah, that's that.
Yeah.
Now, you're right, because everyone can simulate vagal tone, whether being with Resimax or there's some vagal tone
Humming,
vagal
singing,
massage.
gargling, yeah.
The question is, why are you in the low vagal tone? That's a better question to be asked, because when I know why, I can open up the channel so that you're going to vagal without any of this external stimulations. Botox. I mean, I did that for quite some time when I was doing like a masseters and temporalis, and I did help a lot of patients, but that was not a permanent fix. Once that wears off, they go back. The better question to ask is, why are you out of balance? Why your muscles are overworking? Why are you clenching? Why you understood why the mandible hangs out where it is? When your head is offside, your mandible is where your head is off. And when your head is not properly in the center of your gravity, guys, your nervous system is leaking all over the joint, whether it be nervous system, neurotransmitters. We talked about serotonin today. We talked about dopamine, which is an important one for mood, and fatigue and anxiety, all correlated. And I cannot tell you enough how overjoyed I am. This was a dream of mine since the last 5 years ago, because I went door to door finding answers for my own children. My son at the time went into rapid expansions with palate expanders, and I don't think that was the right choice because it didn't solve anything. Honestly, his breathing, sleep, none of that got solved. This is my personal experience. Does it work? I'm sure it gives it immediate relief. I'm not into quick fixes. I'm personally into long-term retention and moving body into where it can function itself. We're all about nutrition and giving body what it needs, the support that it needs, rather than operating on it and prescribing medications. If that's the route somebody wants to take, I'm not it, I'm not denying it, and it's necessary. For some, it is absolutely the only way because they have exhausted ways of recuperating, go back to the normal, right? But we still have to ask the question of how do we get you to be in a better state of being? That my only issue is that doctors haven't started asking those questions unless they have this intuition that you and I have. And not that we don't have it when we go to training. We come out losing it because we are given a script, and here's what you do. You're a dentist. You don't ask these questions. People don't want to answer the questions about their gut when I ask it. You're a dentist. What are you going to do about it? They automatically say, I'm fine, because what is the reason to share their story with a dentist? Because they think I'm only a tooth doctor, or you're just a chiropractor. I love it. You're like, there's no adjusting in my life. I agree. Because if I know why Atlas is off, you only have to put it there once, and it should retain its position. Why? Can't wait. Yes, I know, Sally, you're going to love it. And, you guys, if you could log in, if you find any of our information, his Instagram account is amazing. I spent a good 2 days. When I was in Dubai, I just couldn't get enough. I'm like, this guy. And because he speaks my language. The first time that we met was yesterday, and I think we speak autonomic, we speak nervous system, and doctors should be speaking that. Your breathing issues, your sleep problem, your digestive issues, your mood problems, it's all because your nervous system is rattled one way or another, is not in vagal tone. Can we simulate it with million ways? Yes. You guys remember that one time I gave this example? Wet floors. You come in and showing up, your kitchen is wet, swept onto up to your knees. Okay. Even functional medicine, I'm not again dissing it, but what they're doing is saying, let's mop as quickly as we can as the water comes in, so you never have to deal with dryness, wetness again. But or better yet, replace the floors. That's mainstream medicine. But what you and I look at is, how big is the sink? How quickly is filling up? How fast is the faucet?
Where's the water coming from?
And
Yeah.
where's this kink exactly in that sink? Because once we remove the blockage and the sink can drain and shut down the faucet, the mopping is not. Every question you guys ask in this works and that works. My answer always becomes, even if it's a genetic problem, genetic is like every human has all the genetic codings. Cancer genes were born. We don't develop them later. We have every genetic response. Our DNA can produce whatever protein, whatever we need to do to respond to environment that demands that answer. So when our cell walls are dictating to the inside, the DNA, we need to make a protein to deal with lack of vibration and electricity in the cell wall, because mitochondria is not functioning, or because you're not getting the oxygen, or you're not getting what you need, your metabolism of. When the environment is electively telling the system what to do, yes, becomes a genetic issue. Everything is genetic, I agree, but epigenetic is the reason why it becomes that. We don't end up with crooked teeth because we have bigger teeth or a smaller mouth. How did that happen? Asking that question is more valid than telling me how you fix it. Because if you don't know how they got to that dysfunction, we're throwing noodles to the wall, see what sticks. And again, I have more patients coming out of me ears than I have in my lifetime seeing. And you guys know my mailbox is flooded with patients. I'm flattered. Hence why I'm trying to create a pilot where I can train other doctors. We can train other doctors and centers in your city, in your country, rather than flying to Colorado to provide this level of care. But I want nothing more than every human being having access to their own decisions. It's your body. It's your nervous system. And you can make the better decision if you know what that decision is. If you know why you're not digesting food, why you're not sleeping, why you're not breathing right, you're responsible for getting that treatment. All the doctors can do is line up with whatever that your body needs, and that's it. So we are souping up our clinic with as much diagnostic. I'm so excited to play with your tools tomorrow and see what you see and what people got treated,
Yep.
and have more lenses into the nervous system. It's just better.
And see how it correlates, like how you did my CT today.
Yeah.
You were telling me about like all these different things, and I was like, that actually checks out because I have this, and this with my vestibular system
Yeah.
that I've still been rehabbing. So
Yeah.
it's
The root cause diagnosis. Somebody said the root cause.
yeah.
You're absolutely right.
Yep.
And I tell you what, fact is, everybody calls everything root cause. You know, like I always say, you see the umbrella and you're thinking the umbrellas are causing the rain. Umbrellas do not cause rain. That's just another common denominator. Symptoms are common denominators. ADHD, yes, they have a breathing issue, but what did they have before why did they have the breathing issue in the first place? Oh, it's because their tongue was tied. That's one of the reasons. But when the tongue is not functioning properly, what prevented the tongue from functioning? How was the tongue formed in the mouth, in the womb, that prevented them from growing in the first place? If we cannot get that, would be root cause to me, and then some. And the fact is, we came from a clumper of cells before we were human. That clumper of cell turned into a tube, and a neural tube that basically was the basis of our nervous system. And the electricity that was charged through that formed you. Sorry, guys. What formed you can heal you. The same electric power that formed you, that differentiated every cell, migrating from your brainstem and your nervous system to differentiate, become an organ, a heart, face, whatever, legs, hands. They're all controlled by the same electricity that formed them and was wired to them. And to rewire, get the body to function properly, especially when gravity is, more so because gravity is involved. Without gravity, guys, we can't do anything. So we kind of need it, and what's killing us is gravity. So fix your relationship with gravity, get your nervous system aligned with your pipeline, breathe properly, shut your mouth, sleep well, get good nutrition, spread love, and share our podcast for sure, because everybody needs it. It's epic. Honestly, we got the microphones off. We did another hour. I'm like, this should have been on the podcast.
Yeah.
I mean, I want to have a camera rolling in the background, because I think there's more people can learn from seeing somebody else suffering the same and knowing that I'm not in my own isolation. And we hear all the time, guys. Our ears are full of the stories, and I'm like, you're not alone, guys. I just heard this like at 10 o'clock, my 11 o'clock from Chicago was the same. I had from
all over the world.
States, and they're like, you have no idea how bad it is. Oh, you don't. I know how bad it is, because my 10 o'clock from another state was the same. And we know the answer to your healing is within you. It's called the ultimate treatment plan. And our job, which is so much fun, it's going to get a lot more fun, is to find out what your body needs, so we can do that and that only. It might just be that you need to just get with yourself, because a lot of people cannot even tell me that. The patients that I ask them, what do you want? And how is it going to change your life? They can't even, they're puzzled to answer that question specifically, which means their body has gone to so many layers of compensation that they cannot can formulate that. If they cannot give that answer to me, that tells me they are so stuck, their nervous system is such a stuck zone, they cannot even formulate to me how to get out of that dorsal vagal, what it is that is going to change their life, because they are not safe. When brain perceives not safe, let me tell you, this is this ego wall around us. And more than what that patient needs is other humans. It's like that's what's driving all this centered self. And they see their problem much bigger than what it really is. And anyway, we just can get all crazy esoteric right now, but we're on almost top of the hour. And I know everybody joining, they have asked a lot of great questions. I hope I provided all answers. I'm going back again, making sure there's nobody here that wasn't acknowledged. I appreciate you all again if you joined us. And I'm so thankful, Ryan, that you hopped on this, although you've had quite a day with me at the studio recording.
It's been great. When's the clinic open? I know some people were asking that.
The clinic is, we're projecting August. I will put the date out there for you guys. If you send me DMs, we will keep compiling names and emails, and we'll send an email. Anyone who wants to come down, we're going to have a good educational round so that you're introduced to how the process goes. We're streamlining so the patients don't have to answer a million questions, although they're seeing several providers. That way, you're getting the best of all of us in whatever level you need, and you're going to help us create this. I'm telling you, there's never been a time in history when people demanded more for their health care. And we are coming to the light. We want to be providing this. And I want to surround myself with the best of the best of the best. You're seeing one here. And one of my patients is up here, is also one of the most enthusiastic, because once they go through the experience, they want everyone to go through it. Once you look for an answer for 10 years and you have it, then you want it for everyone you meet. It's like, let me cut 10 years. Let me give 10 years back to your bucket, because you really need to just re-regulate your nervous system and learn to be a human. So what's your youngest age we'll see? So the youngest we would be able to see at our center is at like 3 years old, 3 or 4, because oral appliances come in. I know I can speak for a lot of our providers, but chiropractic and SOT techniques I'm bringing in, they can use that, and neuroreflex integrations. I'm so overjoyed to tell you guys about neuroreflex integration, and we're bringing that in. So that would mean we can actually serve a lot younger because we want to teach them how to swallow, how to integrate reflex, how to learn to walk, and get them properly growing. If we can catch them early as possible, right now I'm not set up for it. I know Ryan told me it takes a lot more team to execute his treatments for younger patients. And even if you don't have the answers, you can have my promise. I will build teams that I can refer you to. The last thing I want to do is live in a patient that I take over, high and dry and say, I don't know. Even if they're complex, I tell you what, you will find out what your body needs once you learn how your body works. Period. That's it. We're part of that education part. So don't put your hopes in providers. Just know that your body is capable of healing. So with that said, we're on top of the hour. We've had a long day. We're going to have another long day. So look out for your stories. I'm going to post a lot as you go around the day. So excited for that to see you, Ryan, and see how your equipment works.
Yeah.
Thanks again, everyone, for logging in. And thank you.
All right. Thanks, everybody.
Yes. Well, you have a good evening, everyone.